Thank you very much. Wow, this is a great topic to debate and discuss. How to improve access, how to improve quality, and how to improve system sustainability. It's often easy and straightforward to solve one of the components in isolation. However, the success lies in addressing all the different components holistically and enacting improvements across the board. So hopefully, as part of the panel today, we'll hear from our distinguished panelists what are key levers across the healthcare value chain on how to do that, from coverage and reimbursement to how the care is being delivered, all the way through consumption of care, bearing in mind the patient perspective. So we have 3 provider organizations with us today. It would be great to hear from your different perspective, right? As PureHealth, the largest integrated healthcare network in the UAE, a large university hospital, as well as an integrated diabetes center. What are some of the key levers, from a delivery of care perspective, where you can enact improvements across the board? Maybe I'll start with you, Dr. Marwan.
Thank you, Jad. I think to address this accessibility subject, if you like, we need to re-look at the whole thing, probably re-engineer the whole accessibility thing. It's not always about a means of delivering healthcare. Sometimes it's capacity issues. Sometimes it's not meeting the expectation of our patients. So technology, I think everyone has addressed that. It's very big and main enablers to enable us to do so. But also we need to, again, look at the things, how we do things. It's not just because we've been doing it for so many years, that means it's the right thing. One example might be looking at considering having less complex, task to be done by who is appropriately qualified person rather than overwhelming clinician for doing things. Another thing is remote, I think, medicine and using technology and so on. So I think we need to look at it holistically and addressing it. And most importantly, also meeting expectation of our patients.
Excellent. Thank you, Dr. Marwan. Dr. Fatih.
Thank you very much, and thanks for having me here, Jad, and thanks for the great topic. We as Fakeeh Care Group, we're operating an old hospital over there in Jeddah, and daily we're managing around 4,000 patients in one hospital. We have another hospital in Riyadh, and we have the new hospital here in Dubai. Patient access point is actually the biggest issue in our operation today. If you have an old hospital, you have to define your patient clientele, and then you have to create the access solutions for them. First, you have to provide the solution. Second, you have to ease the solution. And the third one, you have to maintain it. Because we have different kind of communities that we're dealing. In a new hospital setup, it's a completely different ball game. But if I focus on an old hospital, which is dealing with 4,000 patients, every day you have to maintain and improve the access points. In this regard, as Dr. Marwan just said, technology is definitely helping us. I mean, we're trying to offer different kind of channels where the people can get easy appointment, or they can reach the hospital, or in addition, we're opening outpatient clinics in order to make the access easier for them. Because each insurance card or each corporate account, they have different kind of requirement. And at the end of the day, we know that we are the renowned healthcare operator. But it doesn't mean that we will not provide the best channels for the people to easily access to the service. So in this regard, maintaining the access is going to be very important for us. And whatever we have learned from our Saudi operation, let's say from Jazan, from Tabuk, from Hayal areas, we have patients who want to come to the best care. And we have to also give them a support. Sometimes opening an office in Hayal and Tabuk or Jazan could also help to those people to have an access. And we send our consultants to meet with the physicians over there, then they can come over and get the service from our unit. And the same thing happens for the Greenfield Hospital as well. So in a quick nutshell, if I can just look at this topic itself, First, we have to identify our clientele and identify the needs. And based on that, technology may not be the right solution for this clientele. For them, we have to offer another kind of solution, and then we have to maintain this so then people can reach to our great doctors and great services all the time.
Thank you, Dr. Fatih. Dr. Ihsan.
Thank you for that. So I think I'm in a little bit of an anomaly compared to the traditional healthcare businesses that both our guests were describing. In our case, we are a hybrid metabolic disease platform. So our platform consists of both physical and a digital infrastructure. We have an equal number of engineers developing technology and solutions for our own clinicians as a complete closed value chain proposition. Now, in our case, we hear a lot of use about using innovation in digital health, and it's going to help the patient outcome better. But we see very little adoption in this, and it comes down to a number of things. One is the providers currently able to use these tools efficiently on a daily basis. If you were to go with your Apple Health data to your physician and ask him to analyze your sleep patterns because you know that you have obesity or hypertension, it's affecting your sleep, that physician is most likely not going to know what to do with that data. Second of all, he probably doesn't have time to interpret that data, and even if he knew what to do with that data and he had the time, he would not get paid for that service. So there is a disenfranchised model that currently exists, and I primarily blame our reimbursement model based on that, because we are currently being paid for service. The time that we spend, the tests that we do, the drugs that we described. And if we were really looking at outcomes and we wanted to shift that to an outcome-based model, then we need to look at, what do we need to actually do in terms of incorporating these new technologies and tools to be able to practice better healthcare, better outcomes, and how do we get paid for it? So our approach is very value-based driven. We primarily focus on diabetes, and essentially our mission is very simple. We shift diabetes care away from being episodic and therapeutic to continuous and behavioral change-based. And if we can do that, and if we have the entire component value chain under control, I think we will produce better outcomes than traditional healthcare. So, for us, fee for outcome, performance-based approaches, value-based approaches are the key for adoption in this industry.
Excellent, thank you very much. I think a lot of interesting points have been raised around the importance of having the right model of care, accounting for the patient and population needs, the role of technology, as well as the right reimbursement model to support the right behaviors and the transitions towards value. So I'd like to double click on the patient perspective. So maybe a question to you, Dr. Marwan. What role do providers have, and through what levers can they further engage with the community and with patients to ensure there's the right prevention as well as patient access, the right treatment in the right setting at the right time?
I think we should approach with an active way of communication, but also a passive way of communication. I'll try to explain both of them. So being active, give them the right channels. It's easy channels for them to communicate back to us. Also get them engaged, let them updated with what we're doing, why we're doing it, and so on. Also, again, meet their expectation, know exactly what do they expect, so let them, give them the platform or the chance to express what do they expect from us. Especially nowadays, like they basically don't take us, in silo from the other technologies, other businesses. They always compare us. If we are doing it with the Salat, why are we not doing it with the healthcare, and so on. The other way of communication and engagement, I think also we should use technology to become passive, to know passively about our patient behavior. If someone gets into a service online, for example, and then they did not complete that service, that means they were not happy with the way it's done. So we need to be proactive and do something about it. Again, also look at their behaviors, look at their interaction, and so on. It's like a CRM type of things. picking up the relevant information from the patient behavior, also being integrated with other businesses and consultants and other people who look into those type of things, and try to implement them, use them, utilize that type of knowledge within healthcare delivery, if you like.
Excellent. Thank you, Dr. Marwan. So, Dr. Ihsan, I'd like to get your perspective specifically also on the patient engagement, which is super critical when it comes to diabetic population. If you can maybe illustrate a bit to the audience on how this would result in a superior outcome and impact the sustainability of the sector in terms of providing the right value for the system in the context of a diabetic population.
Sure. So if I look at the current status of diabetics in the UAE, about 75% of the type 2 population is uncontrolled. Despite access available, technology available, probably the best healthcare infrastructure there is available to them, 75% of them remain poorly controlled. And the core reason we believe that this is the case, despite advances in everything, in therapeutics and diagnostics and access and education, is because the providers themselves are still practicing an episodic, heavily therapeutic model of care. And in the context of diabetes or metabolic disorders, we primarily look at it as a disease of behavior. The difference between a well-controlled type 1 diabetic and a poorly controlled type 1 diabetic, with all else equal, insulin pumps, continuous glucose monitor, is behavior. And when diabetes is a 24/7 condition, providers' care need to be 24/7. Why does the care stop the minute the patient leaves the facilities? So if you actually practice a continuous model, an engaged model, collecting data points that actually will be able to, we can derive insights to change that human behavior, which is what we do, you will get far superior outcomes, vastly improved outcomes. We see the same outcomes in as little as 90 days to what traditional care settings do over 10 years. But you have to remain engaged. You have to have a team of clinicians and coaches in the cloud. You need to be able to integrate with every source of data. And you need to be able to integrate that with the electronic medical record, which contains your traditional data. So this is what we've done. We consistently reduce A1C by about 2% in as little as 90 days, and we do it with less medication, because our primary goal is to change behavior over time.
Thank you, Dr. Ihsan. So we discussed, the model of care. Would you like to add anything on that, Dr. Fatih?
I can go to the next question then.
Sure. So the staff is at the heart of the system, right? So ensuring that the staff have these practices that we've just discussed in terms of the right practices, in terms of adopting the latest technologies and what have you, is very important to ensure the sustainability, the outcomes, and the access. How do you ensure you do that, Dr. Fatih?
That's a very important point. But first of all, before coming to this, I was amazed to hear things from a CIO colleague, which definitely shows that the future CEOs will be from CIOs. Because it's very rare to find people talking the sense of patient care. And then the other point, we're learning every day from Dr. Ihsan. He's teaching us about the diabetics things. Very good choices of panelists here. When it comes to the staff, we're investing heavily on the technology, right and left. We hear something, we invest. We bring new solutions to the hospital. But if our staff is not aware of all these solutions, either conservative solutions or the latest technology solutions, then the patient cannot get any service at the end of the day. For that reason, we try to work first with our staff members, starting from the orientation till any level of patient flow, we study them together. And then we want to make sure that our staff is fully aware and then they can utilize this. As Dr. Ihsan said, it comes on the system. And on the system, we have been investing on our own HIS, homegrown HIS, for the last 5 years, millions of dollars. But at the end, why are we investing in that? We want to standardize the care and help to our staff members through the help of AI or the quality matrices and the others. So then they can be aware of that and they can provide the best service to our patients. But again, at the end of the day, we want to also normalize their life. Let's say when it comes to the pharmacy operation, if in case we look at the conventional, the old model of pharmacy, you have to hire army of people, and unfortunately you're working with these people like a dispenser rather than a clinical person. But with the help of technology, that we allow them to feel that they are also part of medical professionals and they can provide the clinical service, which has been brought by the kind of pharmacy robots and the other things. So whenever we consider any new kind of service enhancements, first, we have to look at it from the staff point of view. We want to make sure that it will be useful, it will help them to enhance their work, and definitely we want this reflection to go to the patient, so then the operations sustainability, operations experience will be happening in the right way.
Perfect. Thank you, Dr. Fatih. Maybe I'd like to follow up on that. To what extent do you enable and allow for learning through practice?
You mean for the new technologies? If in case the solution does not have any reflection to the patient side, we'd rather prefer not to invest in this. And we would like to see enhancement on the patient side, and we want to see the enhancement at the patient outcome. Today, if I invest in millions of dollars for a surgical robot, I want to make sure that the length of stay is very well managed at the end of the day. If I will invest that, if the operation hours will be extended, and again, patient will not get benefit, then there is no need for this kind of investment, or there is no need for this kind of enhancement. So that is the way of review when it comes to the additional solutions that how we manage it.
Thank you, Dr. Fatih. Maybe my last question to Dr. Marwan. So again, in the context of the staff, right? So the sustainability, as we discussed, of the system hinges on the sustainability of the staff. So in a time where systems around the world are exhibiting record levels of staff burnout, what can provider organizations do to improve the well-being of their employees and their sustainability of their employees?
I think we can do a lot to basically take care of our employees. As you correctly said, they are the engine. So regardless of how other accessories you have and how good your fuel is, it's not going to help you reach anywhere. So it's very important to take care of them. Part of taking care of them is basically getting them engaged with what you do, getting their views, also get their buy-in. It's much, you're more likely to achieve your goals if your team actually believe in what you're doing or understand where you're going. And listen to them. You have 25,000 employees, that means you have 25,000 innovators, thinkers, and people with ideas. So it's very important to also engage them and listen to their needs. Some clinician, their need might just be to be connected with an academic institution, which is very easy to achieve. It's going to be an add-on or win to the whole institution. But if you don't listen to them, you understand their needs, address their needs, you will not be able to achieve that. You cannot just keep assuming that this is good for them without engaging them. So I think it's very important to do that. Additionally, again, going back to the use of technology, I think the use of technology might help the well-being of our staff, not just during work hours, but also we are introducing a lot of ideas for taking care of patients. We can start with our employees, and this is what we're trying to do with the PureHealth as well, trying to basically get them be our pioneers in certain technologies for the well-being and so on. So, yeah.
Thank you very much, Dr. Marwan. So on that note, I think this is a great note to end our panel on. We'll open it up for any questions from the audience. I think we have a question there. If someone can pass the microphone.
Sorry, just raise your hands, please.
Hi.
Yes.
My name is Dr. Sumaira Haq, and I'm the Chief Medical Officer for PureHealth TMO. It was a very rewarding to listening all of you. So what tools are you using to reimagining the patients or your guest experience?
Thank you for the question. Is this addressed to any of the specific panelists?
I will say gentleman in the center.
So patient experience for us means patient flow. And we, have lived this with the new investment. We're, as I said, an operator for almost half century. And when you want to offer a new hospital and new services, definitely you have to relearn the lifestyle of the people, and then the demand of the patient and demand of the other partners in your ecosystem. For that reason, for our new investment, which is 1.5 billion dirham investment in Dubai, we simply drove the map of the patient experience from scratch. As Dr. Ihsan says, from the home and then till the hospital, and at the hospital, how we can enhance the services, and from the hospital to the other services inside the hospital and admission area as well. And we have created the touch points, and with that way, we were able to re-engineer. The good thing, what happened, we have created all this map and provided a great experience in our new hospital together with our technology partners, Apple, Siemens, Philips, Cisco. But at the end, we have learned, which helped us to re-engineer the service in our mothership hospital in Jeddah. Now we are applying the similar models over there in our hospital, which definitely helps us a lot and improves the patient experience. So I believe the magic here is to create this map from scratch and understand the touch points and look at the partners, what they can provide, because we may not be able to create every solution ourselves. And we need also external partners, which is almost all of them are here now, which helps us to enhance the services. That's how we have worked. Thank you.
Thank you, Dr. Fatih. We have room for one more question from the audience. Please go ahead.
Thank you. My name is Abdurrahman from Pfizer. I have a question for Dr. Ihsan on how scalable this business model is for other chronic diseases, and how did you manage getting insurance engaged on your journey being paid by outcome, and how can you see this sustainable for other disease areas?
Sure, thank you. So when we initially conceptualized this, we were also thinking about, should we have a digital-only solution or should we have a more hybrid solution as we do now? Because the digital-only solution is clearly more scalable, and you've seen some of the other players in the US also go that route, Livongo, Omada, Vertas, similar diabetes solutions in the cloud. The problem with that model of digital-only solution is it doesn't earn you the right to win. Because I think for a lot of patients who are diabetic, probably in this room, it might work. Usually they would be at a higher education level, they would be time-starved, they would look at digital-only solutions as a potential enhancement to their existing diabetes care. But for the average diabetic in Abu Dhabi or in Riyadh or wherever it is, they need to still be touched by a healthcare provider. They need to see a physician, they need to have that engagement. So the hybrid model, I think, for us, it's very scalable, because we don't believe diabetes needs to stay in a hospital setting. It needs to be in a community centers. So it's very easily scalable in that approach. We try to do a lot of the behavioral change as much as possible in the cloud and not physically in the center. Actually, 99% of our work is done in the cloud. There's so much you can do only physically with a patient. Now, in a physical facility. Now, your question in terms of reimbursement, how does this get all reimbursed? What we do is we mimic the same care team that we see physically in the cloud. So, your FTEs double almost in that sense. We use devices that are currently not reimbursed. Every patient gets a wearable. We have a partnership with Google Fitbit on that. Every patient gets a continuous glucose monitor and a weight scale and a smart blood pressure cuff. None of that stuff is reimbursed. We subsidize that for now, and we use our traditional clinical reimbursement models on labs and pharmacy and doctors' time to subsidize a lot of that digital innovation. And again, our approach is to show the insurance companies that the combination of both has a much higher value, and we should be paid actually on the outcomes. So whatever we do in the clinic, we should be based on the outcomes, and we should get paid according to that. Now, it will take some time to go towards value-based approaches. I think it's coming because the current existing overutilized payer-provider relationship is not great. The person who suffers the most is the patient by denial of care, very high insurance premiums, continuous medical inflation, regardless of what the patient does. So that's something we are subsidizing for now.
Thank you, Dr. Ihsan. We're right on the clock.
I think you might have room for one last quick question.
One last quick question. Sounds good. Any additional questions from the audience? There's a question towards the end.
Assalamu alaikum. This is Sam Al-Hassan from Dubai Health Authority. My question is about what kind of challenges, this is for Dr. Ihsan or Mr. Ihsan, what's the challenge that you have with regard to collecting data or getting patient data out of EMR systems of other hospitals? So I think in the US, they have a new law which is called non-blocking data, which allows, enforce actually EMR vendors like Epic, Cerner, whatever, to get data as per the request of the patient and send it through applications to other systems like yours, for example. So can you shed light on that?
Were you able to hear that?
So the non-blocking rule, so for patient-mediated exchange of data.
Yeah, maybe I'll give a quick try to answer that question. So we host two types of data, your traditional EMR data and your IoT device data. The IoT device data is continuous, it's highly personalized, it changes every day, and it's vast. It's almost terabytes every few months per patient. What we had to do is we had to decode our EMR vendor and essentially allow a synthesis of both data sets to sit in one unified viewpoint, which is not easy, and it costs a lot of money to do that. But that's the only way, because EMRs are generally closed systems. They do not allow for the integration of devices, whether it's on the wellness spectrum or even on the clinical spectrum, like medical devices such as insulin pumps. You can't integrate that data easily into the EMR. So we had to decode that and open it up and then kind of synthesize both sets.
We have an IT company here mainly. Providing all these clinical services we learn from him, and we have a CIO. So you will hear from a physician, very, quick thing. We definitely believe in one thing: patient data belongs to the patient, and there is no question on that one. And we want to make the life easy for patient. Let's start from this point, because what we see all over the world in the operations, hospitals, they rather not, make investment in sharing the data with the patient first before sharing with the other ecosystem partners. So we provide this data first from the patient portal and from the mobile app as well. In addition, definitely based on the country regulation here in Dubai, over there in Saudi, we have already integrated our data, and then we share the data with others, because we believe in this too much. The more we share, the more we learn, and then the better operation we can operate, and we will continue to share the data. Thank you.
On that note, any last questions? So on that note, thank you very much, Dr. Ihsan, Dr. Fatih, Dr. Marwan, for sharing all the valuable insights. Thank you to the audience for the interaction and the questions. Indeed, the future of health is an exciting one. It's focused on accessible value, on digitalization, with empowered patients and communities at the heart of it. Thank you very much.